Pharmacology is one of the biggest reasons nursing students feel overwhelmed. There are too many drug names, too many side effects, and too many interactions to memorize. Many students assume that being good at pharmacology means remembering everything, but that assumption is exactly what makes this subject feel impossible. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. In real nursing practice, pharmacology is not about memorizing every drug on the shelf. It is about understanding patterns. Nurses are not expected to know everything a drug does, but they are expected to know what can harm a patient, what requires monitoring, and when something is not right. Pharmacology exists to help nurses give medications safely, not perfectly. Think of pharmacology like learning traffic rules instead of memorizing every car model on the road. You don't need to know how every engine works. You need to know what a red light means, what speeding can cause, and what happens if brakes fail. In the same way, nurses focus on drug classes, common effects, major side effects, and dangerous red flags. At the bedside, pharmacology shows up in very practical ways. A patient becomes dizzy after receiving medication. Blood pressure drops unexpectedly. Heart rate changes. A nurse does not panic or recite a textbook. A nurse recognizes that the medication could be responsible, assesses the patient, and takes action to keep them safe. Most nursing pharmacology can be understood through a few core questions. What is this medication meant to do? What is the most dangerous side effect I must watch for? What should I assess before giving it? And what should I monitor after it is given? These questions guide safe medication administration far better than memorization ever will. Across hospitals, clinics, and community care, nurses handle medications daily. From pain relievers and antibiotics to insulin and cardiac drugs, nurses are the final checkpoint before a drug reaches the patient. Errors rarely happen because a nurse forgot a drug name. They happen when warning signs are missed, assessments are rushed, or side effects are not recognized early. In real practice, nurses follow a consistent thinking process. Before giving a medication, they assess vital signs, allergies, and relevant labs. During administration, they observe the patient closely. Afterward, they monitor for therapeutic effects and adverse reactions. This cycle of assess, give, observe, and respond is the foundation of safe pharmacology. The nclex uses pharmacology questions to test this exact thinking. It wants to know whether you recognize unsafe situations, whether you know when to hold a medication, and whether you understand which findings require immediate action. It is not testing your memory. It is testing your judgment. Now that you understand how nurses approach pharmacology safely and logically, the next step is learning how these medications interact with vital signs and body systems in real patients. That connection is where clinical confidence starts, and that's what we'll build next here at the Learning Studio.